Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Today's talk, I know I'm supposed to probably have these talks be just a few minutes in length because of everybody's busyness and attention span and different things, but this topic is so important. I'm just going to take my time because if your MRI shows that you have white matter disease or you have white matter lesions, it's very, very serious. So I'm just going to go through some of the research and what are the causes of the degeneration of the brain. And that's the main point of this talk, is that if you have white matter lesions that are on your MRI, it's a sign that your brain cells, the actual cells in the brain, are starting to die. So we all know that, of course, some of the brain cells are going to die with aging, but I'm just telling you, when I started at Hines VA Medical Center, so I went to medical school at the University of Illinois in Chicago, so my medical training was in Chicago. Then my residency was primarily at Hines VA Medical Center in a suburb of Chicago, which is actually called Hines, Illinois, but it's affiliated with Loyola Medical Center. And the veterans, God bless the veterans. That's, basically I took care of veterans for 4 years during my internship and residency. And it was amazing how many times I would see white matter lesions on their MRIs, and the radiology report would just say, white matter lesions compatible with small vessel disease. So the beginning of this, we're going to talk about what small vessel disease is and how that is pertinent to you. Because nowadays I have people in their 30s, who now have white matter lesions. So why was it something we only saw in people in their 70s or 80s, and now we have it in their 30s? And just today, there was a report from China that there's a 19-year-old with Alzheimer's disease. It's the youngest person with Alzheimer's disease, like documented by neurologists. And it's my belief that if we don't do something about what's causing brain disease in human beings, we're going to see more and more teenagers, 20-year-olds, 25-year-olds, who have white matter lesions on their brain MRI, which suggests that something's destroying the brain. Something's destroying the brain, and I believe the thing destroying the brain is basically our cell phone addiction and the change in the neck curve. So when the neck curve goes this way, and now the neck curve, instead of being that way, it's like that. Like, that's how the young people come in. It blocks the jugular veins, which drain the brain pressure goes up, and then when the brain pressure goes up, the small blood vessels are what get occluded, and that causes white matter lesions. So you see these white matter lesions, that's what it looks like on MRI. So right here, because it's around the ventricles, so the ventricles in the brain, that's that black fluid stuff. That's cerebral spinal fluid. So there's various places in the brain where the cerebral spinal fluid accumulates. And when the white matter lesions are around the ventricles, we call that periventricular white matter disease. And when it's, see, like right here, see, it's in the cortex or the subcortical region, those lesions are called subcortical white matter lesions. And they have different significance that we'll talk about. But if you've had a brain MRI, look on your brain MRI report, and if it showed white matter lesions, that's what they are, and they're basically synonymous with brain damage. So you're getting brain damage. So remember I said that the going theory is that the brain gets damaged where the small blood vessels are. So we know that veins take blood to the heart, then the oxygenated blood, after it's gone through the lungs, it goes back to the heart, then the heart pumps the oxygenated blood or the red blood to the various parts of the body. So as that oxygenated, fueled blood goes into the tissues, it goes through the capillaries. So the capillaries are the smallest blood vessels, and that's what gives nutrients to the tissues and takes waste products back to the heart. So arterial blood nourishes the tissues of the body, including the brain, and then the waste products through the venules, it goes back to the heart. So I like this one. Oxygenated blood goes to the heart. It goes into the capillaries. The capillaries give oxygen to the cells. The cells have waste products, carbon dioxide and other substances, and eventually it goes to the liver and different places where it's detoxified and processed, and the body gets rid of those waste products in the stool, the urine, and has different mechanisms to do it. So when we talk about small vessel disease, or if you ever hear that, it means that if there's a block in the capillaries, so small vessel disease, there's a block in the capillaries, well, obviously, if tissues can't get oxygen and nutrients, then those tissues end up getting destroyed. And if the brain gets destroyed, we call that, it shows up as white matter lesions or small vessel disease. So you've heard me talk many times about intracranial hypertension. So if the brain pressure goes very high, so it's high pressure in the brain, is that high pressure going to affect primarily the arteries or the capillaries? Well, obviously the smaller blood vessels are going to be affected more. So in my opinion, when a person doesn't have horrible eating, horrible overweight, horrible diabetes, the cause of white matter lesions or small vessel disease in the brain is going to be from intracranial pressure from a change in the neck curve, which I call cervical dysstructure, blocking the jugular vein, raising the pressure, blocking the capillaries, and you get damage to the brain. And if you get enough damage to the brain, we call that brain degeneration, which leads to dementia, which leads to a kind of dementia called Alzheimer's. So this explains you have the brain cells or any tissues of the body. The capillaries give oxygen, food substances to the cells. The cells eventually have waste products, right? So somebody who's on the internet continuously, every time you do that and your brain has to do something, the brain metabolism, the cells goes up. So think about when I was growing up and kids and people were just outside, and now everybody's like this in front of a cell phone. So basically, the cellular activity, the amount of waste product in the last 50 years for the human brain to process has got to be 1,000-fold greater. So that would mean that the waste products getting out of the brain with the jugular veins has to be enormous. Like the jugular veins have to be open, if anything, more than what it used to be, because you have to get all this waste products out of the brain. Well, if the brain, because of the cell phones, the neck curve is getting reversed, then the jugular veins are blocked. So the accessibility of waste products to get out of the brain now is way, way less. So you could see where you could start getting brain damage because of just the overall toxicity, beside just the increase in brain pressure. So if one researches, and I have different articles, if you research the pathophysiology of why the brain gets degenerated, which shows up as white matter lesions, which are hyper-intensity areas on the T2 or FLAIR views of brain MRIs. Obviously, aging is some of it. Systemic risk factors like heart disease, atherosclerosis, diabetes we talked about, and then, of course, I treat ligamentous cervical instability. So aging and systemic risk factors typically affect the endothelial dysfunction and microvascular disease. And then I'd say 5% of my patients that I see, they'll say that their brain fog got worse with like when they got COVID. So many people believe that COVID or the vaccine of COVID, it affects the small blood vessels in the brain, and that's why there's so much brain fatigue going on. When I talk to these people, almost all of them will say they had some brain fog or other symptoms compatible with cervical instability before they got COVID, such as clicking, popping, grinding, tinnitus, migraine headaches, head pressure. And it's possible that an infection that goes into the brain like COVID could then cause some more microvascular disease, and of course that's why they got the symptoms. Ligamentous cervical instability can cause jugular vein compression. The combination of endothelial dysfunction, microvascular disease, jugular vein compression leads to increased brain pressure, reduced brain capillary blood flow, and I showed you the capillaries, the real small blood vessels. That increases blood-brain permeability, so there's a reduced toxin clearance. The combination of that causes increased brain inflammation, axonal damage, demyelination, loss of brain cells, and ultimately, if the axon of the nerve, and I'll show what that is, the axon of the nerve, or the outside of the nerve, the myelin sheath, gets damaged, or there's a loss of brain cells, that shows up as white matter lesions on brain MRI. So this is what a nerve cell is. It shows you where the axon is. So this is the cell body. So this is the part of the nerve, the brain nerve cells that's getting damaged, and the myelin sheath is on the outside. So the question would be is what's going to cause that? Well, obviously if these tissues don't get nutrients, that could damage it. And obviously just from pressure, so increased pressure. So in the office here, we do non-invasive tests to check for brain pressure. And in the people that have white matter lesions and also brain fatigue or brain fog, typically the markers for increased brain pressure are way up. When we get the brain pressure down by increasing the neck curve and stabilizing the neck with prolotherapy, the markers for high brain pressure go down, and the energy level and the brain functioning, the ability of the person to problem solve goes way, way up. And then, like a lot of things in medicine, most medical conditions are progressive, and nerve injury is progressive. So you can imagine if somebody has a little bit of the outside of a nerve cell getting damaged, the myelin sheath, but the pressure isn't resolved, or the microvascular disease isn't resolved, then of course the nerve injury progresses to where the nerve cell dies. They say there's, it depends on who you look at, but there's probably like 1 billion nerve cells. Some people say 5 billion nerve cells in the brain. So that's one of the reasons why you could say, come on, white matter lesions occur with aging. Well, you could have some of them and not have an effect because the brain has so many nerve cells. But when you start getting white matter lesions in 40-year-olds and 30-year-olds and 19-year-olds are getting Alzheimer's, I'm just telling you, you got to take it seriously. One of my patients, he was in the office here, he's like 95, 96 years old, and he is totally with it. So that's what I want to be. I want to be somebody who's in their 90s and still has a very, very active life, and mentally they're fine. But if you're already getting white matter lesions, and even if you're in your 60s, it's a sign that something's wrong and you really got to do something about it. So cerebral white matter lesions, why are they white? The white matter is made up of tracts or bundles, each of which contains millions of nerve fibers that connect the gray matter regions through the central nervous system. So the gray matter lesions are the cell bodies where the DNA is. The nerve fibers are composed of axons which transmit, this is the main thing, it transmit electrical impulses that help neurons communicate with each other. So every time that a neuron cell dies, well, say that neuron cell goes to 1,000 other neurons, well, now all of a sudden you don't have that connection. So axons are surrounded by a fatty material called myelin, which is white. As the nerve cells die or are injured, white matter lesions show up as bright areas or spots on MRI scans of the brain. This condition is also called leukoencephalopathies, or all disorders that exclusively or predominantly affect the white matter of the brain. White matter lesions can occur in a variety of disorders, including genetic disorders, stroke, migraine, multiple sclerosis, toxic disorders, inflammatory conditions, cancer, hydrocephalus, which is where the ventricles get dilated, like there's a block of cerebral spinal fluid, or jugular vein compression, intracranial hypertension, traumatic brain injury, and Alzheimer's disease. So if you look at just the general population, age 60 to 90, in this study with 1,591 people, only 5% had no white matter lesions. It increased with age, and I'm always intrigued by conditions that are more affect women than men. You know, and I've said on other videos that if a condition is more frequent in women than men, and one of the main differences beside hormonal between men and women is that women are way more loosey-goosey. They have much more laxity of the ligaments and the joints than men, that you have to think about the problem may be structural, not chemical, right? They keep looking for, they want to do a drug for Alzheimer's. We got to find a drug for Alzheimer's. Well, what if Alzheimer's or dementia is a structural lesion by the breakdown of the neck curve? That would mean that to stop dementia or to reverse dementia, then the treatment has to be structural. So I just want to state, I'm not saying all dementia or cognitive decline is from a structural cause. I'm just saying that in the year 2023, right, as people look down at a cell phone and now their neck curves are like this instead of like this, or some of the young people or 22-year-olds end up like this, you know, obviously if you cause the vertebrae to go way forward, well, what's right here? The vagus nerve is here, the jugular veins are there. And obviously, especially during sleep when you're laying down, the jugular veins are supposed to be wide open so the brain can flush, get rid of toxins. And we all know when you take a nap for 5 or 10 minutes, like there's times at lunchtime right here in my office, like I have to lay down, like like go from one patient to the other, and your brain's like toast. So I'll lay down, close my eyes, then like 10 minutes later, I'll, nap for 2 minutes. Like, how could I feel so good in like just 10 minutes? Like I'm, my brain's toast. You wake up and you just feel so good. Well, they found that basically the brain is like a washing machine. If your jugular veins are open, just one little nap, 5 or 10 minutes, 2 minutes, 3 minutes, boom, the toxins go out, the pressure goes down, and you're like, oh my gosh, my brain feels so much better. And then when they looked at the white matter lesions in the women, they had more severe disease than men in the frontal lobes. The frontal lobes are the cognitive center, or where you do high-level problem solving in the brain. So when the frontal lobes start getting damaged, that's where you start getting cognitive decline, where you start losing your memory, or you're trying to work, but your brain is having trouble finding words, or you can't remember something, or you can't problem solve. So that's where often the lesions are, or the first lesions that you see when someone's in the process of getting dementia. The other thing too is, we all know, like there's a process of getting dementia or cognitive decline. Like if you don't figure out why I'm so tired and I can't problem solve anymore, it's normally a progressive disorder. So maybe treatment would start out with, I'm going to clean up my diet, I'm going to spend more time relaxing. I'm going to exercise. I'm going to try to get my computer system up. I'm going to try to watch positive things, be around positive people, have my thinking be positive. Like, that would be a first place to start. And if the cognitive decline doesn't stop, then you consider, maybe if I got popping, clicking in my neck, I really should look at my neck. Another study, by the age of 64, 11 to 21% have white matter lesions. By 82, 94% have it. It's characterized by a loss of myelin and axons. Lesions are located in the deep white matter. It's seen together with vessels affected by small vessel disease. It's thought to be due to chronic hypoperfusion, decreased blood supply to the white matter, and disruption of the blood-brain barrier, leading to chronic leakage of plasma into the white matter. Now, this is some of the most significant findings. So again, another study, they showed that if you have white matter lesions on MRI or CT scan of the brain, you have a 3.3 times greater risk of stroke. And you have about a 2 times greater risk of dementia. If you have white matter lesions on your brain scans, you are basically twice as likely to get dementia or die, and 3 times more likely to suffer from a stroke. So my point is, I just don't think in many people that white matter lesions are a big nothing. So I think if you're watching this video, please take it seriously. And especially if you have other signs or symptoms compatible with ligamentous cervical instability, please do a digital motion x-ray to document that. And if you have problems with your curve, which you can just do a lateral x-ray to show that, get your computer system up, look up instead of down. Get some prism glasses, to keep your head up if you're looking down at a cell phone. And then if you have clicking, popping, grinding of your neck, consider getting Prolotherapy to tighten and strengthen the ligaments. Okay, so another study, cerebral white matter lesions, retinopathy, eye disease, and incidence of clinical stroke. Cerebral white matter lesions increase the risk of stroke 3.4 times. So the other study was 3 times. People with retinopathy were 2.5 times more likely to have white matter lesions. So the only reason why I put that in there is maybe the same pathophysiology, the same problems that led to the eye disease might be the same ones that lead to the brain disease. And the most logical reason for that, for people who don't have diabetes, I'm not talking about diabetics, would be that there's a problem with the neck, and intracranial hypertension causes increased eye pressure, which could cause retinopathy. If a person has retinopathy and white matter lesions, the risk of stroke was 18.1 times greater than those without either. Then when they looked at what part of the brain the white matter lesions are, it was parts of the brain that have to do with postural control and gait, walking, the parts of the brain that had to do with memory or problem solving, and it also had to do with part of the brain that gives the person the personality that they have. So anybody who gets a brain MRI or any MRI, you really should get your report, because the doctor might not even said anything about it. So if you have some of these symptoms and then you have white matter lesions, then obviously consider cleaning up your diet, cleaning up your thinking, and obviously get your health as good as you can. This is a T1 image, brain MRI. You can see the dark here, and there's dark there. So this is just another way. On a different type of MRI scan, the white matter lesions are actually dark. So I just wanted to bring that up. And then the greater the white matter lesions, the greater the white matter lesions, the more serious was the dementia. So in other words, mild dementia, like for instance, Severe white matter lesions were 21% of the people, but moderate dementia was almost 40%. So this is just another study to show that the white matter lesions, the severity of them correlated with how bad the memory was in the people or how bad their cognitive functioning was. So white matter lesions do matter. This basically shows two of where the white matter lesions are. So you see that in the frontal lobe, there's more white matter lesions, which has to do with memory. And then the basal ganglion, which has to mostly do with motion, the white matter lesions weren't as severe. So white matter lesions are affecting the frontal lobes, and conditions such as intracranial hypertension affect the frontal lobes. So it's possible for people who don't have diabetes. So let's be honest, diabetes, it really, really affects the capillaries. So if you have diabetes, my advice would be is try to lose a bunch of weight, go to a holistic provider, get on herbal things that help lower blood sugars, get on an exercise program, get on substances that thin the blood. Like a lot of people with small vessel disease, the doctors put the people on platelet inhibitors like Plavix. Natural things that thin the blood would be things like garlic, enzymes, magnesium, curcumin. There's lots of different things, and obviously eating organic and having a diet that keeps the insulin levels low, like more of a high protein, low carbohydrate diet, though some people do better with a vegetarian diet. So that's a whole nother topic, but basically a diet with fresh food that typically also helps thin the blood, and that would help not have the capillaries be clogged. Like basically when the capillaries get clogged and the tissues can't get nourished, that's what causes damage in the tissues, including the brain tissue. Again, they're very significant that white matter changes in patients with Alzheimer's disease and associated factors. I'm not saying the only factor that's giving white matter lesions is structural, because obviously there's a significant risk of white matter lesions when you have high blood pressure and diabetes. But my advice would be is, why not try to resolve the high blood pressure, resolve the diabetes? And sometimes you have to go to a holistic provider that can do herbs, vitamin, exercise, lifestyle changes. Sometimes you need IVs, like IV magnesium and different things to try to bump up your nutrient levels to try to help the high blood pressure and the diabetes get resolved. Now, there isn't any treatment. When I talk about diabetes, I'm talking about type 2 diabetes that's associated with high weight or obesity. I'm not talking about type 1 diabetes where the islet cells of the pancreas are destroyed. And then this just shows that cognitive decline is associated with a decrease in the volume of the frontal lobe. So basically, if you have something affecting the frontal lobe, like increased intracranial pressure, and then you get white matter lesions, then the parts of the brain, the tracts that have to do with memory, they start getting destroyed. And again, I just put this on there again, the white here, those are the white matter lesions. That's parts of the brain that have gotten destroyed. So if I'm 95 and I have these things, whoop-de-doo. If I'm 88 and I have them, whoop-de-doo. If you're 42 and you have them, you better take it really, really serious. And then this just shows the tracts that have to do with memory and higher cognitive function. And this part of the brain especially is affected a lot by white matter lesions. This just shows you the different systems. So you'll see that some of these symptoms have to do with dopamine, some of them have to do with acetylcholine. We all know that when the neurotransmitters of the brain go down, you end up getting depression. So that's why one of the slides I showed you that there's an increased risk of depression when you have white matter lesions. The main point is let's try to stop white matter lesions from occurring. And if they do occur, let's not have them get worse. And then why don't we try to reverse them? So these are some of the tracts that are disrupted by white matter lesions. So again, this shows, like I said before, there's the brainstem, long tracts, the frontal lobe, the thalamus, the corpus callosum. These parts of the brain are extremely important, especially as it relates to memory. These are many diseases are associated with white matter lesions. I've already said stroke, dementia, cognitive decline, migraine, headaches, glaucoma, multiple sclerosis, cardiovascular disease, atrial fibrillation, many diseases. So if somebody got diagnosed with white matter lesions and they've had a history of concussion, you've got to assume that, and especially if there's cognitive decline, that maybe the concussion, yeah, it caused some brain injury, but whenever you have a concussion, it normally means that, here, I'll just do it this way. So this is a head, like say a person's in a sport or they're in a car accident and they hit their head. So when you hit your head on something, the normal response is it twists really quick, right? The real quick twist. So you have a head trauma, then all of a sudden the head's going to very quickly twist. Well, it's that twist that injures the upper cervical spine, and that upper cervical spine, when it's injured, that can lead to upper cervical ligament injury, and that can block cerebral spinal fluid, that can block the jugular veins, and the combination of that can increase the brain pressure. And when the brain can't drain and the brain can't get rid of toxins, you end up like this. The brain just starts getting sicker and sicker, and the person gets more and more fatigued, and ultimately you get cognitive decline. So sometimes the solutions are simple, like just get the computer screen up, try to be outside more, don't be looking down, do exercises that improve posture and the neck, and then if there's instability, then get the instability resolved with prolotherapy. So the number 3 thing that I see here at the Hauser Neck Center is brain fog and tired brain, and many people end up having white matter lesions, and the white matter lesions that obviously can be associated with a lot of different diseases. So white matter lesions, in my opinion, are primarily caused by increased intracranial pressure because there's decreased venous drainage of the brain, and that's from a breakdown of the cervical curve and ligamentous cervical instability. There's plenty of articles, and I've done other videos on how increased intracranial pressure breaks down the blood-brain barrier. So the blood-brain barrier is supposed to selectively let things into the brain and stop things from going into the brain. So when the arterial blood goes into the brain, it's red, but cerebral spinal fluid is totally clear. And then in dementia, Alzheimer's disease, there's different proteins like tau protein and amyloid that accumulate in the brain to show that the brain is unable to clear all the waste products or toxins out of the brain. So that is definitely part of what causes the cognitive decline and ultimately dementia. So drugs are getting developed to increase the brain's ability to detoxify, which is a good thing, but if the brain's inability to get rid of waste products is because the jugular veins are compressed because of the changes in the neck curve, then obviously a better treatment is actually to restore the neck curve, which is relatively simple, which is just postural things like getting your computer system up, looking up instead of looking down. And then if there is ligamentous joint instability, then receive prolotherapy to tighten and strengthen the ligaments. So when there's a breakdown in the blood-brain barrier, there's obviously inflammatory substances, cytokines, immune cells, proteins, substances that get into the brain. So that ultimately is going to cause brain neuroinflammation, which leads to mental illness, cognitive decline, psychiatric disorders, brain fog, and fatigue, dissociative disorder. And on MRI, you can see white matter lesions. So then when there's inflammation or systemic toxic inflammation in the brain or the body, you can cause all kinds of things like brain fog. And often, because the underlying problem is cervical dysstructure or breakdown of the neck curve and injury to the vagus nerve, there's other symptoms that make a person think like it is a neck problem, because obviously somebody's getting a brain MRI for a reason, and usually the reason is the memory's not good or there's some other symptom. When white matter lesions occur, you have to figure out, well, what's causing not just the white matter lesions on the brain MRI, but also what's causing the other symptoms like temperature dysregulation, meaning the person's hot, then they're cold, chronic fatigue, brain fog, all kinds of allergies, autoimmunity, dysautonomia, and all these things can be caused from a breakdown of the neck curve and ligamentous cervical instability. And again, going back to one of the original slides, is aging has some things that it causes. Heart disease, diabetes, poor diet, those cause certain things. But many times the cognitive decline, the brain fog, the chronic fatigue is caused from ligamentous cervical instability. Then inflammation in the brain can cause anything from dementia, anxiety, personality changes, bipolar disorder. But the main thing is something new. Like in the office, I'll test people's heart rate variability. So we had a couple and they both had derealization, depersonalization, dissociative disorder. They just didn't feel like they were in their own bodies. The heart rate variability on the gentleman was very high, meaning that gentleman's vagal tone was very good. So the vagal tone's very good, but the person had a massive change in the personality. Like normally when your vagal tone is high, you're a very calm, caring, unstressed person. But he said in the last year or two, his anxiety's terrible, feeling depressed. Like they both were a type of engineer that take so much cognitive ability. Like they're both college graduates. They both had very high level jobs in a certain type of engineering, and that's where they met. And the female wasn't working just because her brain fog and brain fatigue so bad, and the male was having trouble himself even working, so they flew all the way from Europe. But so anybody whose cognitive ability has decreased, like they can't problem solve, to do 8 hours of work is overwhelming, or the personality changed, you got to think of that there's something going on with the brain, and it's probably that the brain pressure is high, and or the brain can't get rid of waste products. So when there's cervical dysstructure or breakdown of the neck curve, you can get compression of the carotid artery, so the blood supply to the brain isn't so good. You can get obstruction of the internal jugular vein, so you get increased brain pressure. You can have blocked CSF flow, so again, that can increase brain pressure. You can get vagus nerve degeneration, breakdown of the blood-brain barrier. So all these things do what? Toxic substances reach the brain, toxic substances can't get out of the brain. So, and that combined with increased brain pressure can lead to brain neuron cells dying, which ultimately can lead to white matter lesions. This just explains, it just shows that when the brain can't clear, and there's different things that cause the brain not to clear. Insomnia, stress, hypertension, high levels of alcohol or toxins. So obviously if somebody increases their sleep, they improve their vascular health, they exercise, they don't do a lot of high levels of alcohol or other things that might affect the brain. the clearance in the brain can be better. And obviously, if they have a decrease in their size of the jugular veins, then obviously correcting their neck curve and improving the stability can increase the toxins from getting out of the brain. This just shows this is just a model. It shows how most internal jugular vein compression and vagus nerve compression occur at the atlas. So the atlas is the top vertebrae. When the jugular veins are obstructed, you get fluid accumulation and pressure in the frontal lobes. And as we saw, many white matter lesions are in the frontal lobe. This is one of the main centers in the brain that helps us with memory, helps us with problem solving, basically makes us smart, intelligent. So if you feel like you're getting dumber, it's probably your frontal lobe is getting damaged. And one of the causes of that can be upper cervical instability causing jugular vein compression. And basically the blood-brain barrier breaks down, toxins accumulate in the brain, and those toxins can cause inflammation or damage of the brain. Any place where the venous system gets blocked, that can lead to intracranial hypertension, and you can get all kinds of things, including arterial vasospasm and different things in the brain. And ultimately, as the toxins accumulate, it starts damaging brain cells. How do we resolve this? So dynamic structural medicine is just how human posture, motion affects the structure, and the structure affects the nervous system. So obviously eliminating these kind of things, correcting the structural misalignments, the joint dysstructure, the joint stability. And basically, if we align the cervical spine, help restore the curve, help resolve the instability, and we help resolve the instability with prolotherapy. Prolotherapy is an injection technique that stimulates the ligaments to tighten and thicken. So by correcting the curve, stopping the atlas from obstructing the jugular vein, by restoring stability, the jugular veins open, and we document their opening by ultrasound. So by ultrasound, we can see that the jugular veins are more open. And over time in the whole process, like the folks from Europe that I just mentioned, like the amount of care, it's probably about 10 visits of prolotherapy. So, but, you know, within a 6 month to 8 month period, typically the jugular veins can get open. Slowly and gradually, the cognition, the brain fog starts to lift, and long term, the prognosis in them and other people with white matter lesions, if the cause is from ligamentous cervical instability because of breakdown in the neck curve, the prognosis is very good because the curve can be corrected, as can the ligamentous cervical instability.